So how do we determine whether the patient is responding to treatment? Well, I think the first thing that's really important to emphasize here is that the word response can mean different things to different people. And they may often be interpreted differently by the patient and the doctor. So the patient and the doctor have to be on the same page. In some patients, a treatment response means that the symptoms improve and the testing improve. But in other patients, this is not the case. Patients have had sarcoidosis for a long time. The damage from the sarcoidosis and inflammation has been done, and there are permanent deficits, and those deficits are not reversible. In these cases, treatment is indicated not to make symptoms necessarily better or not to necessarily make the pulmonary function test better, but to prevent further decline. Now, treatment with anti-inflammatory therapy may have an effect on symptoms, but it's not going to reverse the symptoms completely. And if the patient has an expectation that the symptoms are going to completely go away and the breathing tests are going to suddenly improve when they've been abnormal and bad for many, many years, that's an unrealistic expectation of the patient. So this discussion has to take place between the doctor and the patient. What are we trying to achieve? So what happens when the patient doesn't respond to treatment? Well, when the patient doesn't respond, we do everything we can to modify those things that we can modify. Supportive therapies like oxygen, pulmonary rehabilitation. If people have holes in their lungs that collect phlegm, we try and do clearance measures to get rid of that phlegm. If they have high blood pressure in the lungs, such as pulmonary hypertension, which is a consequence of the sarcoidosis, then we try and treat the pulmonary hypertension. Pulmonary hypertension does not respond to medications like steroids, methotrexate, azathioprine. And if all of that still doesn't do the trick, then we have to talk about transplant. And we always want to refer patients to transplant earlier rather than later, not when they're sick and, falling off the cliff. We want to refer them before they fall off the cliff so an evaluation can take place and transplant physicians can look at the patient and assess the patient for whether that patient is a good candidate for transplant.